Hi, this is Divya, Assistant Professor, Biomedical Engineering Department in SNS College of Technology. In this video, we are going to see about the limitations of mammograms. What are the limitations of mammograms have? Mammograms are the best breast cancer screening tests we have at this time. Okay, mammogram is one of the best breast cancer screening tests we have at this time, but mammograms have their limitations. For example, they are not 100% accurate in showing if a woman has breast cancer. Okay, they are not 100% accurate in showing if a woman has breast cancer. A false negative mammograms looks normal even though breast cancer is present. Okay, a false negative mammogram looks like normal even though the breast cancer is present. It does not show any symptoms. Even though breast cancer is present, it cannot identify it is a breast cancer. It can just give a false hope, right? A false positive mammogram looks abnormal even though there is no cancer in the breast. False negative is that looks like normal. It looks like normal once even the breast cancer is present. And false positive is that it is abnormal even though it shows there is no cancer in the breast. Okay, it is a false negative result, right? It is a false negative result. False negative mammograms looks normal even though the breast cancer is present. Overall screening mammography do not find about 1 in 5 breast cancers. We have these limitations in the mammogram also. Women with dense breasts have more false negative limitations of mammogram. Okay, once a negative result since we have breast cancer, the result will be of negative, that we don't have. Okay, once the result we don't have any abnormalities and there is a cancer cell. These are the false negative results. This can be identified in within 1:5 ratios. In 1:5 ratios of women, we can identify these kind of limitations in mammogram. Okay, women with dense breast can also have these false negative limitations of mammogram. Next, false positive results. These are the false negative results. What are the false positive results? A false positive mammogram looks abnormal even though no cancer is actually present. False positive mammograms looks abnormal even though no cancer cell is present. If there is no cancer cell is present, also it shows abnormal. Okay, that is a false positive. Abnormal mammograms requires extra testing. Diagnostic mammogram, ultrasound, and sometimes MRI, or even a breast biopsy also required. Okay, a false positive mammogram looks abnormal when there is no cancer cell is present actually. For this kind, we will go for many diagnostic procedures. Diagnostic mammogram, ultrasound, and sometimes MRI also. or even breast biopsy is also required to identify these kind of breast cancers or normalities. False positive results are more common in women who are younger, have dense breasts, and have had breast biopsies, have breast cancers in the family, or taken estrogens, or taking estrogens. These kind of women will have cancer cells. Okay, will have false positive in the sense then the report will be of abnormal, but the patient will not have any kind of cancer cells. Okay. About half of the women getting annual mammogram over 10 years period will have a false positive finding. The odd of false positive finding or highest of the 5 mammogram. Women who have passed mammogram available for comparison reduces their odds of a false positive finding by about 50%. False positive mammograms can cause anxiety. Why? Because abnormalities are there. Looks abnormal, but there is no cancer. Fine. If this situation occurs, normally the patient will be of anxiety. They also lead to extra tests to be sure cancer is there or not. Okay, which costs time and money and may even cause physical discomfort. These are the false positive results and the false negative results in the limitations of the mammogram. Thank you.